Vaccine is finally here, but that does not mean we can ease up at all. Dr. Richard Heffu is back to break it all down for us. Doctor, good morning.
Good morning, Raul.
Okay, so here's the deal. Once we get the vaccine, the first and the second shot, we still have to wear a mask. Can you explain why?
We do, Raul. Yeah, there's several reasons why. First of all, the vaccine is not going to be widely available for everybody, probably until sometime next year. Secondly, even though we get the vaccine, it does take weeks. And remember, we have to have two vaccines right now, separated by about 3 to 4 weeks. And so during that period of time, we don't have enough protective antibodies. So theoretically, we could still get infected by the coronavirus and pass that on to other people. So that's why the important things, as you mentioned, wearing a mask, social distancing,
sure,
and washing surfaces are still going to be the most important things to slow the surge down.
I think a lot of people are used to when you get the flu shot, you get the flu shot every year. That's become the norm. Do we know yet in terms of research this vaccine, how long it's good for? Is it 6 months? Is it a year? Is it a couple of months?
So the data is really not that clear at this point, Raul. But remember, we've had data for other vaccines, for decades, and this is a virus. So it's likely that we'll have very long-term immunity with this. In other words, this is probably not something that you need to have done every year. Part of the reason why we have to have flu vaccines are different each year is we have several strains, and they're not always the most prevalent ones. So each year it can be different. And so the vaccine that we got the year before may not be as effective this year.
You kind of hinted on this. Will the immunity work for everyone? Because I know obviously everybody's different. Everybody reacts differently. And it won't occur immediately, but does it give immunity to everybody who takes it or not necessarily? Because we heard 95%.
Here's what we say. So here's what we say in medicine. You never say never and never say always,
yes,
right? So 95% is really pretty high if you think about it, but you're correct. It's not 100%, and certainly people that are immunocompromised, that don't have the ability to mount a good immune response, in other words, don't have the ability to create adequate protective antibody levels, may not be as protected as most healthy people would be.
Yeah. If you get the vaccine, and there's so many questions here, obviously, because it's got done so quickly. Right. Can you still spread the virus? I think you kind of touched on it a little bit. Let's say you're like, oh, I'm good.
You can.
Yeah.
I wish it worked. I wish it's not a light switch. For example, the vaccine that you take, in order for you to, the first vaccine is thought to maybe you have 50% protection. After the second vaccine, which is 3 to 4 weeks after the first vaccine, you're at that 95% levels because you're challenging your body again with that second dose. The antibody levels are already high, and you're kicking them up to the level that's going to protect you. So, but during that period of time, you're absolutely right. You're still likely to get this virus. If you're only at like 50% for the first 3 weeks, then certainly you could get the virus. And after the second dose, you're still probably about a month away from being safe.
How much of the population has to get this vaccine for it to actually put an end to the pandemic, which we know now it's all over the world?
Right. So we're talking about herd immunity, right? So herd immunity means that we have to have at least 65 to 70% of the population has to be immunized adequately, so we don't spread this virus around. And the problem is that we talked in the past, or you've heard in the past, people talking about, this natural herd immunity. I mean, some countries toyed with the idea of, well, let's just have everybody get infected, which obviously was a bad idea for many reasons, but not the least of which is that although we produce protective antibodies when we get an infection from COVID-19 or whatever it may be, it's short lasting. So in other words, most people are getting a milder form of COVID-19, the actual antibody level, protective level may only last a couple of months. Now, if you get a more serious infection from COVID-19, unfortunately, then your antibody level may be higher and may last a little bit longer, but certainly not as long as if you're immunized. That's really the gold standard.
Sure, and people need to know you still need to get the vaccine even if you've already had COVID.
Absolutely, because your antibody levels are going to drop and you can get reinfected. We've certainly seen cases in the literature of there being reinfection with COVID-19.
The new strain in the UK, that was the last couple of days, and Boris Johnson has straight up just locked down all of the UK because of this. But then some experts are saying, oh, it's nothing to panic about. But boy, when you lock down the UK, it sure sounds like, oh my God.
Exactly. Well, part of this, I think the public needs to understand that viruses mutate. This is a natural thing
Yes.
with viruses, and there's certainly, there is some preliminary evidence that the newer strain of COVID-19 in the UK may be more contagious, but there's not any evidence as of yet that
Right.
it's not going to be as sensitive or responsive to immunization as the original strain.
Severe allergies, because I know my father-in-law, my wife had severe allergies, so that was a concern there too.
Right. Yeah, and there's certain ones of the vaccines that are milk based. If you have an allergy to eggs or milk, then you need to let your healthcare provider know. There's new vaccines coming out. Right now the Pfizer vaccine we've seen, Moderna has just gotten approved. There may be others coming down the pike.
It's still just a fascinating process to witness that we now are sitting here, end of the year, 8-9 months, and we have a vaccine for this unbelievable work.
It's unbelievable. It's a fast track, and it really does show the amazing healthcare team, what we've been able to accomplish in medicine in almost 2021. It used to take us many years to get a vaccine. As you know, the MMR took almost a decade.
Oh, sure,
I remember when I was a kid, we had the polio. In a little sugar cube, we'd all line up for that. That took a long time. This is under a year, and this is a pandemic. So I think that it's a testament to the brilliance of researchers around the world that we've gotten to a point we have.
Researchers, doctors, nurses, everybody, we thank all of you for all the work you do. Dr. Richard Chafu, thank you so much for the time. Merry Christmas, happy holidays
Thank you,
to
Raul.
you.
Happy holidays. Be safe.
All right. Still